This week's segment of Wellness Wednesday, we're talking about beating the winter blues. We're also talking about, of course, seasonal affective disorder. We are delighted to have with us Holly Moffett, a psychiatric nurse practitioner with Behavioral Health Outpatient Clinic. How are you doing, Holly?
Good. Thank you for having me.
And thank you for being here to discuss what a lot of people go through, the winter blues. So what is seasonal affective disorder?
So seasonal affective disorder is a type of depression that happens with the season changes. So for most people who struggle with depression with seasonal affective disorder, they tend to have a depressive episode in the early fall through the winter months, and then when spring time hits, it kind of goes away. So that's what happens for most people. It can be the opposite though. Some people tend to get depressed in the spring and summer months, and then their depressive symptoms go away during the fall and winter months.
Wow, that seems so unique for a lot of people to get depressed during the spring and summertime. I would think more so winter. So tell us, what are some of the symptoms of seasonal affective disorder?
Okay, so
right now, depressed mood.
Depressed mood is one of the biggest. That's what people don't like the most, is feeling depressed and sad. They also have sleep issues. Usually it's sleeping too much, but for some people they don't sleep enough at night. They tend to either sleep too much or not enough. Appetite changes are a big concern for a lot of people because they tend to gain weight. They tend to crave carbs such as breads, sweets, pastas, that kind of thing. So and then poor concentration is a big concern for people, especially if they're trying to work or you know, it really affects their lives. And then social withdrawal, so they lose interest in doing the things that normally make them happy, which, you know, family and loved ones, they start noticing a lot, and that's usually when people start getting concerned for their loved ones.
And when it comes to treatment plans, what are some of the treatments?
So one thing that you can do at home is light therapy. That's where you can, for one thing, get out in the sunshine. Now in the winter months, sometimes that can be really hard for people because it's too cold. So one thing that you can do, if you have a window where the light comes in, you can stand in the sunshine from within your house. It's important that you get direct sunlight to the skin though, because that's what helps lift the depression. If you, another thing you can do as far as light therapy is they have light boxes that you can buy from Amazon, and so that's another thing you can do if you can't get outside. The other thing that you can do is medication therapy. So you can speak with your primary care physician. They can refer you to a specialist, either a psychiatrist or a psychiatric nurse practitioner can prescribe medicines for you, which really do help. And then psychotherapy, that's where you can sit and talk with a counselor about how you're feeling. They can teach you different healthy coping skills to deal with the depression. And then lifestyle changes such as getting plenty of rest, eating a healthy, balanced meals during the day, and that sort of thing.
All right, I was going to say, and also getting out there and exercising.
Yes, exercising definitely helps with depression as well.
All right, well, thank you so much, dear Miss Holly, for joining us this afternoon.
Thank you for having me.